Hello, I'm Diana Keogh, Editor-in-Chief of Sherwick.com. Today we're talking to Dr. Rocio Moran, who is the Medical Director of the General Genetics Clinic at the Cleveland Clinic. We're talking to Dr. Moran today about genetic testing. Dr. Moran, the first question came off of Twitter, and this person asks, what is actually involved in genetic testing and does it hurt?
So genetic testing usually involves a blood draw, but it can involve a cheek swab where cells are taken and the DNA is extracted to look for a particular gene of interest. There are also genetic screening tests that are more comprehensive that can look at all the genetic material in a comprehensive way, looking for missing pieces or duplicated pieces. Usually there's some discomfort from the blood draw, but for the most part, genetic testing is painless.
Dr. Moran, if a woman finds out that she is genetically predisposed to getting breast cancer, what happens then? What are the next steps? Does she get counseling? What exactly happens?
In anyone considering undergoing genetic testing, we highly recommend that individual seek out genetic counseling to discuss the risks and limitations of the test. If the test comes back positive, it's important to note that there are multiple individuals who can help you discuss what your risks are and what actions you can take to prevent disease.
Dr. Moran, how is genetic testing different than your family physician doing a thorough family medical history?
I think the difference is that we really spend a lot of time talking about that and utilizing that information to make personal health risk assessments. So a physician may ask you that information, but it isn't clear that they truly act on it or have specific recommendations to make. So again, pushing your physician to really examine your family history and to really help you make lifestyle changes that can avoid disease is really the most important thing you can do right now.
Dr. Moran, who should consider genetic testing?
So individuals who would benefit from genetic testing include those who have a family history of a particular disorder in multiple individuals in their family, at a young age at diagnosis, or a young child with mental retardation, developmental problems, or birth defects. It's important to know that while the genetics of many complex disorders are slowly being understood, their application in terms of ordering a genetic test to clinical practice is not quite there yet.
Dr. Moran, thank you so much for joining us here on Sherwick.com. This has been great, helpful information. If you'd like to find out more about genetic testing, please go to our website at www.sherwick.com.